The therapy called apheresis is a procedure in which blood is collected and part of the blood, such as platelets or white blood cells, is taken out while the rest of the blood is returned to the donor.
There are two apheresis machines. One is called the trimer machine and the other one is called the spectra optia machine. Different blood components. And in that process of separating, it separates components according to how heavy they are. The most heavy components will remain down. Then the lighter ones, that is the plasma and the platelets, will be on top. And this machine collects platelets and plasma.
Dr. Dungu further explained that the new treatment method is more efficient compared to the past, and this will help in saving lives, a relief from the past where 6 donors were needed to get 1 dose.
What has been happening is that we get 6 donors, each one gives us a bit to make a pool of 1 unit. But now we have 1 person who can give us probably 2 units or 3 units, depending on how big they are and how much platelets they have.
The Uganda Cancer Institute also now has the capacity to conduct bone marrow transplants, and this will help in treating diseases like leukemia and sickle cells at Mulago.
This modality of treatment is also used in removing stem cells. Stem cells are the cells we use to make other cells in a process called a bone marrow transplant. Uganda Cancer Institute is at the final end of starting full implementation of this program of bone marrow transplant, where conditions around blood can be treated using this modality of treatment.
Meanwhile, Dr. Dungu encourages anyone who gets persistent swellings, especially on the limbs, to approach the Uganda Cancer Institute for proper diagnosis.
We encourage all those people who have swellings that have not been confirmed whether they have cancer or not to come to the Uganda Cancer Institute.
Joy Navulo, Church of Uganda, Family TV News.